Hello, my name is Corey Marino, and I attend the California State University of Northridge at the College of Health and Human Development in the Department of Kinesiology in the Studies academic program. This article is the adaptation of running biomechanics to repeated barefoot running. Its investigation was performed at University of Hamburg in Hamburg, Germany. It was published in the American Journal of Sports Medicine, which has an impact factor of 6.057. Its authors include Karsten Hollander, MD, PhD, in the Department of Sports and Exercise Medicine and the Institute of Human Movement Science and Department of Sports and Rehabilitation Medicine, BG Trauma Hospital of Hamburg in Germany. Dominique Libel, PhD, Department of Financial Economics and Statistics at Bonn University, Bonn, Germany. Stephanie Meany, MA, Department of Human Movement and Exercise Science, Institute of Human Movement Science, Institute of Hamburg at Hamburg, Germany. Klaus Matus, PhD, Department of Human Movement and Exercise Science at the Institute of Human Movement Science at the University of Hamburg in Hamburg, Germany. Stefan Willwacher, PhD, Institute of Biomechanics and Orthopedics, German Sports University, Cologne in Cologne, Germany. Astrid Zeech, PT and PhD, the Department of Movement Science and Exercise Physiology, Institute of Sports Science, Friedrich Schiller University, Jena, in Jena, Germany. Previous studies have shown that changing acutely from shod to barefoot running induces several changes to running biomechanics, such as altered ankle kinematics, reduced ground reaction forces, and reduced loading rates. However, uncertainty still exists whether these effects remain shortly after the period of barefoot running habituation. The purpose of this was to investigate the effects of habituation to barefoot versus shod running on running biomechanics. The hypothesis was that a habituation to barefoot running would induce different adaptations of running kinetics and kinematics as compared with habituation to cushioned footwear, running, or no habituation. The study design was a prospective three-arm randomized single-blinded control study over 8 weeks. A three-arm trial consists of the experimental, the active control, and the placebo group. A single-blind study is a type of clinical trial in which only the researcher doing the study knows which treatment or intervention the participant is receiving until the trial is over. Participants were healthy, physically active males and females between the ages of 18 and 35 years old, without any experience of barefoot or minimal experience in shod sports, including gymnastics, ballet, combat sports, and barefoot running. Further exclusion criteria were musculoskeletal injuries 6 months before the study and neuromuscular diseases. Participants were randomly assigned to a barefoot intervention group, shod intervention group, or passive control group. A randomization method stratifying for sex was used with a primary block of 6 lots and a secondary block of 4 lots per study arm. Random allocation is a technique that chooses individuals for treatment groups and control groups entirely based by chance with no regard to the will of researchers or patient conditions or preference. This allows researchers to control all known and unknown factors that may affect results in treatment groups and control groups. The protocols of this study were divided into 7 sessions approximately 1 week apart. Each session consisted of habituation to barefoot or new footwear locomotion by running on a treadmill. Participants ran in the interventional footwear, barefoot or shod, for 15 minutes on the treadmill at 70% of their previously determined VO2 max. The interventional shoe was a commercially available cushioned running shoe and individually standardized for every participant. The passive controlled group did not receive any intervention and continued with their usual physical activity in the habitual footwear over the 8 weeks between pre and post tests. The methods: before and after the intervention, a three-dimensional running gait analysis was conducted on an instrumented treadmill with a capacitance base pressure platform under the surface. The pressure data was used to determine vertical ground reaction forces by multiplying each pressure sensor signal by its area and subsequently summing the data from all sensors. Participants from all three groups ran at one fixed velocity, 10 kilometers per hour, barefoot and under standardized footwear condition in a randomized order. After a habituation period of 5 minutes per test, two 30-second trials were recorded. Participants were given a 1-minute rest between trials. Only the first trial was investigated and the second trial was served as a backup. The statistical analysis and tools used were: the treadmill surface was 174 by 65 centimeters and contained 10,240 sensors in a sensing area of 136 by 54 centimeters. The data was sampled at 200 Hertz, and this treadmill was shown to be reliable for the assessment of temporal and kinetic parameters of running. Retroreflective markers were applied to specific anatomical landmarks of the pelvis and lower limbs accordingly to the lower body marker. The acute effects were tested with paired t-tests adjusted for multiple testing with Benjamini-Hochberg method. The paired t-test is a method used to test whether the mean difference between pairs of measurements is zero or not. In the Benjamini-Hochberg method, hypotheses are first ordered and then rejected or accepted based upon their p-values. For analyzing the habituation effects, they tested for group effects, test condition effects, and interaction effects in the pre to post-test differences with a mixed effect model incorporating a random intercept at the participation level. To account for unbalanced design, they approximated the denominator degrees of freedom with the Kenward-Roger method. The Kenward-Roger method offers a more precise small sample estimator for the variance and covariance of the fixed effects parameters and the approximate denominator degrees of freedom in t-tests and f-tests. The Tukey-Honest significance difference tests were applied in the post hoc analysis. Marginal means were used to describe the mean change calculated by the mixed effects model. The Tukey-Honest significant difference test is used to test differences among sample means for significance. The results. During the pre-testing, overall differences for barefoot versus shod running occurred for the foot strike index, ankle, foot, and knee angles at ground impact, as well as vertical loading rate, peak force, contact time, flight time, step length, and cadence. No differences were found in the average force. Changes in biomechanical outcomes after habituation to barefoot or shod running. The foot strike index showed significant pre to post test differences in the barefoot habituation group for the barefoot running condition. The post hoc effect estimated showed a significant increase of the foot strike index more towards the anterior foot placement rather than the posterior in the barefoot habituation group as compared with the shod habituation group in the running condition. For vertical average loads rates, significant differences in pre to post test changes were found in shod habituation group for the shod running condition, as well as a tendency for higher vertical average loading rates in the barefoot habituation group and reduced vertical loading rates in the shod habituation group in the barefoot running condition. The post hoc effect estimation revealed an increase in vertical average load rate in the barefoot habituation versus shod habituation group for the barefoot running condition. The average vertical ground rate force showed a significant pre to post difference in the barefoot for shod running condition. The barefoot habituation group increased the average vertical ground reaction force rate for the shod running condition. The purpose of this randomized controlled study was to investigate the causal effects of habituation to barefoot locomotion on running biomechanics. Additionally, acute effects of barefoot running were analyzed as compared with shod running. They hypothesized that habituation to barefoot running would result in different adaptation of the lower running kinematics, and foot strike patterns as compared with habituation to cushion footwear or no habituation. In this random controlled trial, an 8-week habituation to barefoot running led to an increase in all of foot strike index, average ground reaction force, and vertical average loading rate during landing, while no changes were observed in active shod group and the passive control group. Pre to post test changes in foot strike index significantly differed between groups, but sagittal ankle and foot angle at ground contact did not. The direction of changes in both angles represented a more anterior foot placement. Reasons for this could lie in the reduced power for kinematic data or a higher sensitivity of the foot strike index in the detection of small changes. However, when habituated to barefoot running, participants exhibited higher vertical average load rates. This is contradictory to the asserted injury prevention potential of barefoot running attributed to reduced vertical average load rates. As a possible explanation for an increase of impact loading in the study could lie in an increase of ankle stiffness. There is evidence for reduced ankle stiffness when acutely changing to barefoot and simulated. I believe the study was valid. The statistical analysis was strong and had extremely low p-values, and used viable methods, tests, and corrections such as the Kenmore-Roger method, the Boniferroni corrections, Tukey-Honest significant difference test, and paired t-test adjusted from multiple testing with the Benjamin-Hochberg method to test the validity of their findings. The limitations that came to mind were the duration of the study and the frequency of the interventions. The study should have taken place in the time frame of half a year to a year, in my opinion, and far more frequently than once a week. The data shows that there were significant changes in foot strike index and ankle, foot, and knee angles at ground contact. The peak force, contact time, flight time, step length, and cadence also had a significant change. One of the main purposes of the study was to show that barefoot running would decrease injury risk, but the barefoot runners showed an increase in vertical average loads, which is the opposite of the result intended. Running barefoot should strengthen and tighten foot muscles to help stabilize the arches in the foot. Shoes can allow somewhat of a crutch to be formed and deny the foot and ankle the opportunity to add muscular strength and stability. I chose this study and article because I've always been fascinated by the contrast between barefoot running and shoe running. Common sense will tell you that with all the science and technology at our disposal, that shoes have been created to maximize our potential as humans. But when we look at the data, it tells us that our bodies are finely assembled machines, and when we fine-tune the parts, we can still exceed expectations. I learned that allowing the barefoot to hit the ground and interact with the lower extremities at more of an intimate level will allow us to change and adapt our running kinetics and kinematics.